Hi, I'm Jane Baker, a clinical psychologist practicing at Filmy Flake Studios, a film studio created by Kamal Sheikh, an actor and a filmmaker who believes in creating films that touch aspects of mental illness so as to create mental health awareness. So today let's explore about bipolar disorder. Bipolar disorder or manic depression is a mood disorder and is a name given to the experience of abnormal moods or exaggerated mood swings. This illness is characterized by the experience of extremely high moods, where one becomes extremely euphoric or elated, and the experience of extremely low moods, where one becomes extremely sad and finds it difficult to experience pleasure. The high moods are called manic episodes, and the low moods are called depressive episodes. These episodes can range from mild to severe and also affect how a person feels, thinks, and acts. However, it is important to remember that some people may experience different patterns associated with the disorder. For example, some people may experience only one episode of mania but more frequent episodes of depression. This illness affects men and women equally. And now let's explore the features of bipolar disorder and begin to understand the manic episodes. Mania is an extreme mood state of this disorder. It describes an abnormally elevated euphoric, driven, and or irritable mood state. Hypomania is a term given to a more moderate form of the elevated mood. It can be managed without the need for hospitalization as the person remains in contact with reality. However, it is very easy to move rapidly from hypomania into a manic episode. Symptoms of mania include irritability, where a person experiencing an episode is usually quick to anger, touchy. Many people, when in an elevated mood state, experience a rapid flow of ideas and thoughts. Because of this rapid thought process, they become easily angered when people don't seem to comprehend their ideas or enthusiasm for some new scheme. Decreased need for sleep is another symptom. One of the most common symptoms of mania, and often an early warning sign, is the increased experience of energy and a lack of need for sleep. Rapid flow of ideas is another symptom where people experience an increase in the rate at which they start thinking. They move quickly from one subject to another subject. Sometimes thoughts can become so rapid that they begin to make no sense, developing into a jumbled, incoherent message that the listener can no longer understand. Another symptom is grandiose ideas. It is common for people who are manic to think that they are more talented than others or have unique gifts. As a person's mood becomes more elevated, these beliefs can become delusional in nature. Uncharacteristically poor judgment is another symptom. A person's ability to make rational decisions can become impaired and they may make inappropriate decisions or decisions that are out of character. Another symptom is increased sexual drive. People, when they experience mania, often experience increased libido and may make less well-judged decisions about the sexual partners. Now, let us explore about depressive episodes. Depression is a mood state that is characterized by a significantly lowered mood. Its severity, persistence, duration, and the presence of characteristic symptoms can distinguish a major depressive episode, the other extreme mood state of a bipolar disorder, from a milder episode of depression. The most common symptoms of depression include persistent sad, anxious, or empty mood. People often describe depression as an overwhelming feeling of sadness and hopelessness. They may experience a loss of enjoyment in the activities of everyday life that they used to take a lot of pleasure in. Another symptom is poor or disturbed sleep. A person, when they are depressed, often experience sleep disturbances, and this can be due to an increased anxiety. They then find it difficult to fall asleep or wake up frequently during the night, worrying about day to day events, or wake early in the morning and are unable to get back to sleep. Another symptom is the feelings of worthlessness or hopelessness. Sometimes people become overwhelmed with a sense of their own inability to be of use to anyone and can become convinced that they are useless and worthless. Thoughts may revolve around the hopelessness of the situation and the future. Another symptom is a decreased interest in sex. As the person becomes more depressed, they gradually become less interested in social activities and sex. Another symptom is poor concentration. Thinking can become slowed and the person can have difficulty in making decisions. They find it difficult to concentrate on reading a book or on the day-to-day tasks such as shopping. This can often create anxiety or agitation in a person. A person suffering from severe depression could also report thoughts of suicide or suicide attempts. When a person becomes overwhelmed by the feelings of hopelessness and despair, they may have thoughts of ending their lives or make plans to commit suicide. Now, let's explore about mixed episodes. A mixed episode is characterized by the experience of both depressive and manic symptoms nearly every day for a period of time. The person experiences rapidly alternating moods such as irritability, euphoria, sadness, and there may also be insomnia, agitation, hallucinations, and delusions, or suicidal thoughts. So now let us explore what to do if you do think that you do have the symptoms or you actually suffer from bipolar disorder. So let us explore what to do if you do think that you do have the symptoms or do actually suffer from bipolar disorder. The first thing to do is to approach a mental health professional. In India, you could approach an ICI licensed clinical psychologist because they are licensed to practice and they are qualified and experienced to assess, diagnose, and treat bipolar disorder. They would also use psychotherapy as an approach in treatment, which would be individually specific per client. It is also important to also approach a psychiatrist, especially to manage the severe symptoms of bipolar disorder. So once the symptoms are managed well, then you could begin treatment as well in psychotherapy. Do not worry about confidentiality, as qualified doctors also do maintain strict confidentiality of all the cases that they handle. What you shouldn't do not delay in approaching a qualified professional as soon as you can, as in certain cases the level of the symptoms could get more severe and it would also interfere in your day-to-day activities. Do not approach unqualified professionals without a license to practice due to various reasons, as the so-called treatment provided to you may not be treating the symptoms of bipolar disorder, and you may end up feeling much worse. You can definitely try reading self-help books, but this may not be enough to treat bipolar disorder. Just because some different types of treatment work for someone doesn't mean it will work for you. So please do consult a qualified mental health professional before going for such treatments. Lastly, if you have any questions, queries, and concerns or need support, do feel free to contact me. Thank you.